Public health has always been about systems and bringing technologies together so we can tell a story. But I'll be honest, prior to the pandemic, it was really hard to do that.
With the number of cases that were being diagnosed and people who were being hospitalized, it became apparent pretty quickly that our healthcare system was strapped. They were stressed, and they needed help managing surge. We didn't have a system to collect information from our hospitals, our acute care hospitals, on how many of their staff are out sick with COVID, how many ventilators do they have, how many open beds do they have. We were able to develop, with Microsoft's help, a new system called WA Health.
Essentially, WA Health was designed to help the hospitals and facilities keep track of their PPEs, which was important at the height of the pandemic. So that was one of the first things we had to get out the door immediately, because we had to be able to forecast where there were shortages.
Think about it, 100 different facilities with different processes, all trying to share information all at once. And here we are trying to collect that information. So what the Microsoft solution allowed us to do was to help people recognize how to share that information. And then when that information got to us, guess what? Now we had useful information that we can make decisions on.
Microsoft helped us to develop our first public health cloud environment, both to stabilize our disease reporting system that was hosted on-premise. We needed to get that in an environment that was scalable, but also to build out a data warehouse and a cloud analytics environment that allowed our epidemiologists to do some predictive analytics to understand where the pandemic was headed so that they could be proactive in their protection measures.
Our agency throughout this pandemic has had to deal with very difficult challenges and problems. And just in time, right as those challenges are being identified, has had to come up with solutions. And the way to come up with those solutions has not just been singularly about Department of Health, but it's been about our private partners.
So in January, I actually got a call from the governor's office asking if I'd be interested in heading up this new center called the Vac Center, which was an effort to bring the private sector to partner with the state of Washington Department of Health to mass vaccinate the state of Washington. There was a shortage of the vaccines, and the state had to ramp up very quickly how to respond. And literally, people were spending days and exasperated and in tears to get information on where to get vaccinated.
The stories that we were hearing were just heartbreaking. You know, people that were getting fed up to the point where they were just giving up and kind of being resigned to not getting vaccinated because they couldn't navigate the digital infrastructure that existed to make those appointments.
And so we needed to figure out how to get information out quickly, how to make the vaccines available in an easy to reach way that was equitable.
And that was where the Vaccine Locator app was born. Last time I checked, it's been used by over 3 million Washingtonians. It never crashed, it never failed. And so, it speaks to the team, the expertise that we got from Microsoft that helped us build something that was ready for that level of use and scale and demand.
Microsoft created another dashboard for the vaccine ordering and distribution. It was able to have every provider that was enrolled in the program, the number of times vaccines were moved from one provider to another, and gave us an equitable way to distribute it. And this was a dashboard that was used internally at DOH as well as our partners, our local health department. So they were able to see our 4-week forecast, which is part of how we supported distribution of the vaccines. We would get a forecast from the CDC. Also, it gave us real-time ability to answer media inquiries as well as inquiries from the governor's office. It truly helped us see a full picture, and our local health partners see that picture as well to support vaccine ordering. So we're almost at our 1-year mark, coming December, of vaccine being distributed in Washington State. And it's been a long road to get us here, and a lot of late nights, early mornings, and just teamwork.
I think the state has an enormous opportunity now to drive public health education. We really are at a moment in time where we could distribute that education pervasively across the state, 100%, which then lifts the status of our health as a society in the state, which I think is a super, super exciting moment.
I think this is now a great blueprint for how you bring all sectors to bear on a massive problem.
We had to learn on the fly. And now that we're there and we are in that environment and we are releasing systems in the cloud and we are leveraging things like Azure DevOps and things like the Power Platform, moving to the cloud has helped us build in that scalability and helped our systems be able to handle that load.
We can't rest on our laurels. We have to constantly be looking for ways to improve our processes, to train our people, and look to the future, to think about what we have learned, what we have done, and build a better future tomorrow. And that's transformational health. And I'm hopeful that that is what we're going to be able to learn from this pandemic.